Hi all, welcome back. For these next few lectures, we're going to discuss human tissues. And so we're really going to discuss kind of the field of histology. And we're going to talk about how to differentiate between different tissues, what kind of a little bit about what tissues might make up a certain organ, etc. And so we'll go through connective tissue, skeletal muscle tissue, or just muscle tissue in general, epithelial tissue, a nervous tissue, and um, and we're going to talk about the different regions of the body. Okay. First off, I want to talk about a case study, and this is why learning things about histology might be important for an allied health individual to know kind of, well, what's the timetable for something like an injury. So let's say there's a 20-year-old soccer player, college soccer player, and they suffer a meniscus tear in her knee, okay? And the MRI reveals that she damaged the fibrocartilage. Okay, and so again, this is an example. I don't expect you to know too much about this. You will by the end of the lecture. Okay, and so that fibrocartilage, it's limited, has very limited blood supply. So the athlete is advised that healing will be slow and may require surgical intervention. Okay, so if we pull out the vitals, it looks like temperature's normal, heart rate's okay, okay, blood pressure's not horrible, respiration rate, okay, fairly good. So what would be, say, the nurse's role in this situation? Okay, a couple things. First of all, monitor the pain and swelling. Okay, there's going to be pain associated with this. Apply ice, compressions, etc., as prescribed. Okay. Educate on, remember, we're talking about a 20-year-old college soccer player. You need to really educate them on the limits and the weight bearing that they should limit with the knee. Otherwise, it will just increase and slow the time to healing. And then, especially if there's surgical intervention that probably will be needed, especially if this individual wants to continue to play soccer, um, physical therapy would probably come into play. And so reinforcing what physical therapy instructions are would probably be a function of this. Okay. So let's ask some questions regarding this. Okay. So why does fibrocartilage heal poorly compared to other connective tissues. So again, you probably don't know this yet because we haven't covered this, but this is just kind of a overview of a scenario. Okay, so it lacks chondrites. It's avascular, relying on diffusion of nutrient supply. It has too many fibroblasts to allow repair. It's constantly replaced by bone tissue. It's composed entirely of adipocytes. Okay, some of these it doesn't make much sense, like adipocytes, adipose tissue. I don't think your fibrocartilage is made of fat. Okay, it's B, it's avascular. There's very few or very little blood flow that makes to it. And so most of what has to happen is diffusion from outside to get inside. And so that's why the process is very slow. Fill in the blank. The connective tissue sheath that surrounds most types of cartilage contains reserve chondroblasts. Is called the pericardium. Okay, and many of you have probably experienced the pericardium and didn't even know it. So pericardium is the covering around things like bones also. And so if you are chewing on a chicken bone or something and there's a very thin layer of material there, the pericardium is what that's called. Explain why a meniscus injury in the knee often requires arthroscopic surgery and how knowledge of that cartilage histology informs a physical therapy approach into allied health. This really gets back to this, why is it poor healing? If something's poor healing, it'll often require surgery to repair, and that's exactly what's going on. Okay, so that blood supply is very low, so the healing is very slow. For a 20-year-old who, their body has a limited time window to play competitive soccer, surgery will help speed up the process. And in some cases, it may not ever heal independent of surgery. Okay, it depends on what region and how bad the tear is. Okay, so allied professionals should, just reiterate what physical therapists are saying. Okay, whether it's regarding like weight bearing, whether it's regarding what kind of exercises, just that low impact rehabilitation, especially in younger individuals who, they don't want to be on crutches for months. Okay, they want to get back, especially if they're a competitive athlete. They want to get back on the field, and so it's really important to apply that kind of knowledge. All right, so let's dive into histology and talking about cells. So there are about 50 trillion cells in the human body, 200 or so different cell types. They are arranged or put into kind of four main tissue types. Okay, and there are other categories that branch off these tissue types, but the four main ones that we talk about typically in anatomy and physiology is epithelial tissue, connective tissue, nervous tissue, and muscular tissue. Okay, organs are a combination of two or more tissue types. Okay, so you'll get things like epithelial tissue, which then gives rise to the connective tissue, which its job is to connect the epithelial tissue and something else. And so that might, connect to the muscular tissue. The nervous tissue is going to be embedded in all three of these. Okay, so that you can have muscles firing, you can have sensory, you can have blood flow in case of deep wound, other things that might occur. Okay. And histology is the study of tissues and how they're arranged into organs. Okay. All right, primary tissue classes, again, tissues, similar cells, they work together. Okay, this is what makes us a multicellular organism. Okay, and not all multicellular organisms have tissues. Okay, but the majority do, and that's because they have similar cells in similar regions, and the cells work together to perform some kind of role, some specific function. Okay, and that might be, an action potential. That might be the stretching of fibers. That might be processing waste. Okay, all these kind of things are involve tissues, and then you get a bunch of these tissues together, and they can work as an organ. Okay, and we already talked about the primary tissues. So again, epithelial, connective, nervous, and muscle. Okay, they differ by lots of different things, and we'll talk about many examples of these. Okay, the types, the function of the cell, what the cell looks like, and that's not even getting into the intracellular differences, like how many mitochondria, how much endoplasmic reticulum, okay, what kind of proteins are being made, these kind of things. They differ in those aspects also, but they differ on the extracellular matrix too. So like the size, the shape, the structure, that kind of thing, the relative amount of space they might take up, what other cells are they associated with, all these kind of things. So that matrix, the extracellular material, is typically composed of a few things. So fibrous proteins, okay, scaffolding proteins, proteins that allow for things to be connected, okay? And then often what we just call a ground substance or a gel-like ground substance. And this will have fluids, tissue fluids. When those tissue fluids are high in water, right, there will be some gas mixed in, some nitrogen, carbon dioxide, oxygen, okay, some other things, minerals like some sodium, calcium, potassium, okay, other kind of nutrients, maybe even in that kind of fluid you might actually even have some sugars. So you might have some carbohydrates, some glucose, fructose, that kind of thing. You could have some wastes, okay, nitrogen based waste, maybe you have some ammonia, that kind of stuff. And then of course you can have some fat based hormones, okay, that are driving things. And so that fluid is known by lots of different terms, tissue fluid, extracellular fluid, or ECF, and interstitial fluids. But these are the sites of, the material, the liquid-like material that's associated right outside of the cell. Okay? And we'll look at this as we progress. Okay. Where does all this come from? Well, we kind of have to talk about embryonic tissue or embryonic development. Okay, so when the human egg is fertilized, that zygote starts to divide. When it starts to divide, it starts to produce its first tissue layers. Okay, and there are three germ layers. Okay, this is what makes us what we're called triploblastic, or three tissue types, three tissue layers. Okay, we have a ectoderm, an outer layer. Okay, and that gives rise to the epidermis. Okay, so that outer layer, your skin, and even internally, the insides of regions that are interacting with the external environment. So the inside of your trachea, your stomach, your intestine. Okay, all these are part of the epidermis, and it gives rise to the nervous system. Okay, so your brain, spinal cord, okay, the nerves that are coming off of it. The endodermis, or the endoderm, okay, that's the inside material, okay, and so this will give rise to mucous membranes lining your digestive tract, the respiratory tract, the digestive glands, okay, hormones, so other types of glands like thyroid gland and sweat glands and other things that are associated kind of with that inside material. Normally, this is associated with production of fluids per se, okay, or associated with mucus or some kind of excretory cells. And then the mesoderm, okay, this often is part of what we call the mesenchyme. Okay, so it's gelatinous. There are cells there, okay, so it's cellular, but you're going to have lots of collagen fibers. You're going to have lots of kind of protein-based long structures that just combine the two. It combines the ectodermis and the endodermis. Okay, and that's what really gave rise, or gives rise, to the majority of the organisms. And if we're talking about humans, it gives rise to the cartilage, the bone, the blood. The skeletal system is the mesoderm of the organism, the middle of the organism. Okay, and we'll come back and chat about this as we progress. Okay. So one of the key components of histology is determining what tissue you're examining. What tissue are you looking at? what's the components of the tissue, what's it made out of, how many different cells there might be, what's its function. Okay, to get at a lot of this, it really you have to get at how was that material prepared. Okay, so first of all, normally we talk about histological sectioning. So we will use like a microtome, which is a very, very thin blade knife machine that cuts extremely thin sections of material. So you might embed, say, a gland. Maybe you embed the pituitary gland into a wax-like kind of mold, and then you take really, really fine sections of it. Okay, only a few cells thick. Okay, and uh, and then you can examine it. Okay, to get to that point, often we preserve things in formalin or formaldehyde. That's a fixative that allows for the material to not rot and not be able to allow for fungi or bacteria or anything to feed off of it. Okay, and then a lot of times we have to stain it, and different stains stain different cellular components. Sometimes if we're interested in looking at something like a nucleus, and this is what you did if um, you've taken a lab class. Often, in lab classes, you'll scrape your cheek and you'll dye it with methane blue, which dyes the nucleus. Okay, so different stains dye different things. Okay, sectioning. Okay, if you're using a microscope slide, sometimes you'll see a couple abbreviated letters on that slide, and it tells you what kind of section that material was, or what kind of direction that material was sliced. Okay, so three-dimensional structures, they get sliced on a two-dimensional plane, and so if it's a longitudinal section, it's cut along its long axis. Okay, if it's a cross section, okay, or transverse section, it's cut perpendicular to the long axis. Okay? And if it's oblique section, it's normally cut at an angle to the longitudinal section. Okay? So if we look at this, an example of this, something like this, a longitudinal section of a bone, okay, along its long axis, along its longitudinal axis, okay, of something like a vein or an artery, same thing, okay, this could be along like a trachea, or really any tube that we're talking about. Okay, a cross section would be a crostate. Okay, give you something like this, same thing. Okay, and then an oblique section is at an angle. Okay, and there are different angles that are used. Some angles show more of are better for certain structures, and other angles a little better for other structures. So it just depends on who's doing the sectioning, what kind of plane they're going to use, and different planes will give you different features and allow you to examine different things. All right, again, not all tissues are sectioned, and many of you have probably experienced this. Okay, some tissues are smeared. Okay, especially if the tissue is associated a lot with liquid or with some type of fluid. Okay, so soft tissues are often smeared on a slide, like blood, okay, semen, saliva, okay, lots of tissues like that are there. Even glands that are associated with them are sometimes smeared onto a slide to get a uh, good look at it. Okay. Spread, also a little different way of looking at things. So not section, not a smear, but really a spread, which is kind of similar to a smear, except for smears are normally done with pressure. spreads are typically done kind of knowing the material that you're looking with and just laying it on a slide, and then looking at that material. And that sometimes will happen for like aerial tissues and things like that. Sometimes they'll do spread for things like bone marrow and material like that that can be spread out a little bit. So here you can see two examples of that. This is a smear. This is a red blood cell smear, or I shouldn't say, this is a blood smear, not a red blood cell smear. Okay, there's lots of red blood cells here. You can also see the ones that are nucleated in here. Okay, those are different types of white blood cells. Okay, and then this is kind of a spread, okay, where you can see this cobwebby look to it. That's kind of the collagen fibers in the tissue that kind of are spread throughout. Okay.